Hi, my name is Uva Mason. I'm a dietitian here at Lovelace Westside Hospital. I've been here for 7 years now, and I particularly enjoy diabetes and educating people with diabetes and getting their blood sugars under control with diet and exercise.
Ideas for moving. So many options. Start by finding activities you enjoy. And just like starting a medication, you may have to experiment a little. It may take some trial and error to find the right fit for you, but have some patience, try new things, and don't get discouraged. Giving up shouldn't be an option. If you think taking medication is important for your health, exercise should be thought of as equally as important. The wonderful thing about physical activity is that there are so many options and ideas. There is something for everyone who has the desire to move. So, no matter what kind of injuries or limitations you may have, there is always some kind of movement you can do or modifications to utilize to move your body. Even if it's just doing chair exercises, that's something. There are several different types of activities that are important for our bodies. Aerobic activity is best for our hearts and lungs. So ideally, we want it to be intense enough to elevate our breathing and heart rate somewhat. So things like brisk walking, jogging, running, riding a bike, swimming. If you're so inclined, you can combine all three of those and try triathlons. There's racket sports such as tennis, racquetball, or pickleball, stair stepping, elliptical machines, any other various cardio machines, and dancing. Resistance and strength training, which is really important for maintaining our muscle mass as we get older, and delaying sarcopenia, which is the natural loss of muscle as we age due to our body slowing down and just not making the same amount of hormones as it used to. So, lifting things like free weights such as barbells, dumbbells, even things around the house such as canned goods or jugs. There's weight or cable machines, which most senior centers or community centers have. Things like resistance bands or tubes that are pretty affordable and easy to use. And sometimes just our own body weight's enough for weight bearing exercises like squats or push ups. Flexibility and stretching. Most often and best used for warm ups and cool downs, but also important for maintaining movement and coordination. So, activities like yoga or holding static stretches for 20 to 30 seconds. Try to avoid bouncing or pain to reduce risk of injury. And then balancing, which is critical in preventing falls as we age. So, single leg stands, yoga incorporates a lot of those of balancing exercises, and stairs. So, using stair steppers or benches or taking actual stairs allows for us to stand for on single legs for even a brief moment of time. There is also a NEAT approach to activity. NEAT is an acronym for non-exercise activity thermogenesis. This is basically the energy we use during the day, just doing our typical daily activities. So if you're having a hard time incorporating or starting a fitness plan, consider ways to increase your energy during everyday activities. Stand more. It's said that sitting is the new smoking, so think about when you can be standing instead of sitting. And for every half hour you sit, stand or move for 5 or 10 minutes. This can be done while watching TV, reading, or talking on the phone. Um, Set an alarm and make sure you periodically get up and move and get some circulation to your booty. If you go to kids' or grandkids' sports events, you can pace the sidelines or walk around the field or court. If you have bleachers, you can stand in the back row, maybe even pace the bleachers if there's no one else sitting in the back row. When shopping, try to carry groceries in a basket instead of using a cart. Not only is this weightlifting, this will also help limit the amount of food you end up buying, so hopefully you prioritize the essential healthy foods that you really need. Park far away. I know this is a common one a lot of people know about, and it really is a way to get more steps in, as well as saving you time trying to find a closer spot. Again, use the stairs instead of elevators. Even if you just go up a flight or two of stairs before using the elevator, those are valuable steps to get in. Find things you could do to add more activity to your daily routines, such as gardening, yard work, pulling weeds, sweeping, vacuuming, washing the car, walking the dog. Um, Try walking to close appointments or errands that you can do, dusting, or other physical chores that might get you some movement in. Not only will your living space be cleaner and healthier, but your body will be healthier too. Consider making a list of general activities you do typically and think of ways you could add more movement in. This is also a great start to maybe eventually transitioning to making more time for individual movements and focused activities, maybe starting that walking or yoga routine, even if it's just for like 5 or 10 minutes. And remember, any movement is better than none, and every movement counts.